Hello everyone, I am urologist Omar Erdamakaya. Today I will talk about penile venous leakage. This is one of the causes of erectile dysfunction. How does erection develop in men under normal conditions? The man receives a stimulus from the outside. A visual comes, or a smell. A neural impulse goes from the brain to the penis. After the neural stimulus, there is a considerable expansion in the penile arteries and blood begins to enter the penis intensely. Those two spongy cavernous bodies in the penis start to fill with blood. And this reaches a pressure and the blood in those cavernous bodies presses so hard on the veins. Because the blood in the artery comes in very fast and those cavernous bodies suddenly lock up, they flatten and the blood flow in the veins is completely stopped. In other words, the artery compresses, the vein does not return the blood at all. This is how normal physiology works. But if blood leaks into the veins of the patient during an erection, what happens then? Like a flat tire leaks air from somewhere, the pressure of the penis starts to drop. And loss of erection occurs. We can understand this with penile Doppler. When we look with penile Doppler, we can understand whether there is venous leakage or not. Of course, loss of erection may occur in this case. This penile venous leakage occurs both in young patients and elderly patients. So is there a treatment for this penile venous leakage? When we look at the American and European treatment guidelines, as the training in Turkey is usually organized according to those, says that do not perform penile venous leakage surgery, the chance of success is low, the patient's expectation is high. But when we look at the world, very successful surgeries are performed on penile venous leakage in the Far East. There is quite a difference between the surgeries performed. For example, in penile venous leakage surgeries performed in Turkey, much fewer veins are ligated. There are not many large-scale vein ligations. When we look at the studies conducted abroad in Thailand, we see that around 130 to 150 veins are ligated while 10 or 20 veins are ligated in Turkey, Europe or America. Of course, when we try to ligate 130 veins, the operation takes quite a long time, around 4 hours and 6 hours. The surgeries performed in America and Europe have been shown as an application that can be performed within 1 to 2 hours, even in an outpatient clinic. Again, they looked at its effectiveness in studies conducted in Europe and America. They looked at how long the effectiveness continues after this surgery. They said that it has an effectiveness of around 6 months, 2 years. But again, there are many studies done in Thailand on this subject. They have 10 years of follow-up. In 10-year follow-ups, they have shown that success rates are up to 80%, 90%. There is only one thing, of course. They applied this penile venous leakage surgery to young patients in Thailand. Between the ages of 18, 30 and 35. Penile venous leakage surgery was not performed on those over the age of 40. One of the most important factors affecting the success of penile venous leakage surgery is that it is performed in young patients. After the age of 40, the success of penile venous leakage surgery begins to decrease considerably. Why? Because then penile venous leakage is not the only problem. The response of the tissue is also very important. Which patient should penile venous leakage be performed? How should it be detected? For example, let's say the patient has erectile dysfunction. Penile Doppler ultrasound is performed. Penile Doppler ultrasound reveals venous leakage. Some patients say that, for example, when they change their position, their penis goes down immediately. Penile venous leakage should be suspected in these patients. If leakage occurs immediately when the patient changes position, if the pressure of the penis decreases, we should consider the possibility of penile venous leakage in these patients. In fact, if the patient is young, we should consider the possibility of penile venous leakage again. In a young male patient with penile venous leakage, if he responds to Viagra and Cialis, he can be managed with Viagra and Cialis. Or if he responds to other regenerative methods, he can be managed with those. But for example, if the patient has a penile venous leakage problem and does not respond to Viagra or Cialis, then penile prosthesis is on the agenda. But before putting penile prosthesis, I think it is necessary to give the patient a chance of penile venous leakage surgery, especially if the patient is young, the patient undergoes an operation one more time. If the venous leakage surgery is successful, the patient can produce his own spontaneous erections and can live his life in that way. What I want to explain in this video is that there are many different treatments for erectile dysfunction in the world depending on the region. As I said, very different treatment protocols can be applied in the Far East or Russia compared to America or Europe. When you look at the reasons for the application of treatment protocols and the results, both sides performed the same surgery, but the results were different. Why are the results different? Because unfortunately, the experience, interest and attention of the surgeon who performs the operation affects the results of the operation very much. Or different techniques can be used. The technique applied by the Thais in penile venous leakage surgery is very different compared to the techniques applied in America or Europe. As I said, if the patient is young and has penile venous leakage, I think the patient should be given one last chance with surgery. Thank you for listening.